Thank you very much for joining us for another podcast live here at Vibe in Los Angeles. Today, I have the privilege of hosting two incredible guests. We're going to be focused on the topic of provider data management, a huge issue in the industry, but solutions are around the corner. I've got Megan Schmidt. She's the president and chief executive officer of Madaket Health. Megan, welcome to the podcast.
Thanks for having me, Saul.
Of course. And we also have Nicole Berryman. She's the senior vice president of growth and partnerships at Verisys. Nicole, welcome.
Thank you.
It's a pleasure to have both of you on the podcast. How's the conference going so far?
Good. We got in late last night, had a little bit of a delay with the airplane, but it's good. It's been a good conference. Had some good conversations and networking.
Awesome.
Lots of pots of energy flowing. The sun is out. It's a beautiful venue. And yeah, it's hard to be inside a little bit, but a little bit of good conversation here today.
That's great. Well, I'm so glad you guys made time in your busy schedule to do this interview. Tell us a little bit more about your background and how your company approaches provider data.
It's great. I'll take this start. So 20 plus years in healthcare, integrated care delivery systems, payers and providers. So everything that touches the payer ecosystem of data. Madaket is deeply rooted in provider data management. So we work in EDI, payer and provider enrollment, and provider data exchange. RCMs, EHRs, providers, and payers are our primary customers. And we've been leading the charge on provider data accuracy. It's more than just technology. We look at a data-first approach, which is part of what we're excited to talk about.
Yeah, to tell you a little bit about Verisys, we've been in business for over 30 years. And if you look at it, we have two different sides of our organization. We have the credentialing side, where we're one of the largest credentialing organizations, but then we also have the data and monitoring side. And if you look, that's really where we've gone as an organization, where we've pivoted. We've leaned in heavy with our data and monitoring. And if you look at it, we service a lot of the different spaces within healthcare. That's a huge umbrella. We have the payer space, we have the provider space, pharmacy space that we work with, but then we also work in healthcare technology. And that's why we're here at this trade show, because a lot of the times there's the platform with our data in behind it.
That's fantastic. Well, I am excited to dig in. Let's get into it. What is actually happening in the industry right now? What are some of the trends making waves?
Yeah, I would say that it's a lot of the talk is around having good provider data, good enrollment data. So how do you achieve that? Do you achieve that with having a platform first to where you're focusing on the technology, or do you focus on, okay, we know that we need to have the most clean, pristine data. How do we focus on that? So that's a lot of the waves. It's trying to figure out where do you want to invest in, where do you want to start that part of the process.
It's dynamic.
It is dynamic. I think it's also chasing a little bit of that myth, the golden record that's there. And I call it the myth because this is an always living, breathing type of ecosystem of data. And so it's something that the industry goes round and round of single source of truth, golden record. Mm-hmm. And it's really about keeping the data dynamic. Mm-hmm. And that to me is probably what is the forefront of today. Lots of great technology partners here today at Vibe that are looking to solve that. But you need to come at it differently. The industry has not been able to solve that, and probably golden record is not going to get us there either.
I was going to say, and I think that it's not just one person that has that solution. It's partnering together to be able to say, hey, what do you have the best of and what do we have the best of? And how can we go out there to possibly achieve that golden record?
Yeah, partnerships are really important. And so, Megan, tell us a little bit more about this data-first mentality. How has this become important for organizations?
So I think when you look at all of the sources of data, those that sit in various pieces of the ecosystem, they're all disparate. They're all ever-changing. It's very dynamic. So if you take the approach that it's kind of a one and done, a one-time cleanse, or if I can just get data flowing in this one direction, unfortunately, that doesn't solve the problem. So early treating it and understanding that this data needs to come in from lots of disparate channels, take it as that it's broken and it needs to be fixed at all times, and that at all times during the process, it's that consistent monitoring that needs to happen. Technology enables that. Right? Putting bad data into good technology just doesn't magically fix that data. And so I think that's where the industry coming together and say, it's about having the highest quality of data, always monitoring it. But again, it's an always on campaign of refresh. And that's what good technology enables, but without really proper provider data management, we're not solving that root foundational cause.
And right now, it's not happening, right? It's like nobody's doing this.
Nobody's doing it. If there were, then we wouldn't see, the average provider directory that reaches the end consumer still only about 50% accurate. And that's at the end of the day, whether you're talking about claims denials, provider directories that members are accessing for care, to trying to move to value-based care and understanding how providers are attributed to members and claim systems, we're not solving for that root cause. Again, there's been lots of great strides. And this is where you have to take a different approach to the data before it enters into the technology.
And I think if you take it back even a step further, a lot of people are focusing kind of what I just mentioned about on the platform. Let's take it back further on education. How do you get good data? What does good data consist of? What sources are we getting this from? Is it even possible? Yeah, it is possible. So let's figure out, one, educate, how do you get there? And then look at the solution. And the solution comes from that data that's pumping in behind it. Because I have a saying of garbage in, garbage out. If you're going to pump in garbage data into a platform and a solution and a workflow, you're going to get garbage out that you have to then cleanse and then say, okay, at what part of the process do we have to go back and look at our data to see if we can get that 50% to a 60% to a 70% to an 80%? How do we get there?
Right.
Yeah, there's big opportunities. Go ahead, Anne. You were about to comment.
Well, I think that you also have this opportunity to say those errors are going to show up further places downstream if you don't further move up that upstream of where data enters it. And that, to me, is where you start to have a change in the conversation. So I'm always like, what can we be doing differently when we're saying it's not working today? These are the different strategies to deploy.
That's fantastic. And the whole saying technology can amplify issues is kind of what we're talking about.
It is.
So why has it been so difficult for the industry to create that single trusted provider record? Nicole, do you want to come?
Yeah, I think it goes back to where I was talking about the education piece. Where do you get these sources from? Are you going to the primary source to get them? Are you getting them from secondhand? Are you getting them from a huge data provider that doesn't follow FCRA or healthcare compliance guidelines? It goes back to that. Where are you getting this? What is the source that you're getting it from? From there, what do you have and where do you want to send it? What type of workflow do you want to bump it into?
I think the other place that I would say is this is where the technology really does start to matter. So if you're taking broken processes, broken spreadsheets, 20 pieces of disparate data, and you're still not cleaning it before you put it into workflow and process and where else it feeds in the ecosystem, the bad data just starts to perpetuate and roll downhill, if you will. So good data in, but then this constant monitoring that has to happen. And it has to be a circular refresh. It can't be I take it in from a data source, even a great trusted one, and then I just move it along that somebody else touches it and manipulates it before it goes to the end user. So to me, it's this really end-to-end type of strategy for data and data management and how it moves. And technology should be able to automate that. Good technology does. And it should also have that cleansing process behind it.
Yeah, and I think if you look at, just to add on to that, if you look at it from our standpoint, it's Verisys, we do credentialing. So if you get all of the information in from the provider, usually it's self-provided, then you go through the credentialing process and you verify, okay, yes, this person can be credentialed. And then they go to a committee state or they go to a monitoring state. That's when our data drops off and where yours would pick up for the provider directory, for provider enrollment. So if you have clean data coming in from the beginning and it flows so smoothly to the end process, you get to enrollment, that means that once it hits those payers, when it goes into their network or their health plans, you're going to have cleaner data.
You absolutely are. And also knowing that there's still a refresh of data that is constantly going to be coming, even though we've had into a single source that was starting to
ongoing. Mm-hmm.
And I mean, it sounds like there's huge opportunities for education on this topic. Why don't people know these things?
Well, that's healthcare.
It's dumbfounding.
What's old is new. What's new is old. But at the end of the day, unfortunately, some of what healthcare was built off of, I don't believe in the finger pointing. I worked in the peer and provider world for a very long time. Providers, right, are looking at delivering high quality care and managing patients. They weren't built or designed with systems to move their data around for all of the reasons that we use it today.
Yeah.
Payers were meant to pay claims. They were not meant to manage all of the ecosystem, right, that's now touching that data. And so you've got homegrown systems, you've got one-size-fits-all solutions that are out there. You've got people that are doing a lot of change in their tech today. But understanding that the data that comes into that technology or a platform for your process, that has to be very clean in order for it to be successfully used in technology. So the best of both worlds is when you have really good technology, it's mandating and using clean data in a variety of different ways. But to me, you weren't built for this, and you don't have people that are trying to unravel how they've done business for many years.
Yeah.
Well, not only that, I think that it's kind of, you can play ignorance. If you don't know, you don't know. So it's going in there and educating, but also once you are educated, then you have to take action upon it. It's like if you play the ignorance card and you're like, oh, well, I didn't know about it. I'm just doing the best that I have because it's always worked this way. Yeah. Well, no, let's educate you and then you can decide from there.
Yeah. I think it's also an interesting piece because, there's more stats in baseball than there is in healthcare. Healthcare looks at it the same way. If I'm kind of at par with everybody, if we're all at 50, 60% together, then I'm not as bad. Right. I'm not the worst. And so, unfortunately, that's been the measurement in healthcare. And it's not because people aren't striving for quality, but if there's not a spotlight on, right, that 50, 60% actually being bad, and now we're at filters, that's, I think, the movement that you're seeing is, okay, that stat didn't make sense until I tied all of my payments and my quality and my claims denials and provider abrasion and member abrasion at the end of the day. That, to me, is what's, in your words, amplified where we're at today.
That's great. That's the insight. We've got to be able to say this 50% is not okay. Mm-hmm. Not, hey, I'm just as bad or just as good. This 50% is not okay. It's not getting us to where we want to go at.
Or let's wait until the regulatory environment says it's not okay, and then we take actions. Yeah. Absolutely.
If it's not about the golden record, then what are you actually solving for?
To me, it is about data first. We want to partner in a meaningful way to understand your data. It is not about curating a single source of truth. It's about creating clean data, a data management strategy that then can be automated in technology. And that's where you're starting to see the return on investment. That's where you're starting to see process improvement, that technology can solve for that manual waste and manual error. And in many cases, things that you haven't thought about in your ecosystem of where you're sending data. So to me, technology is the enablement, but data first is really the strategy. And I think that's the heart of what brings us together.
Yeah, and if you look at it, I kind of introduced Verisys in the beginning, and we have the two different sides of the business. We have the credentialing, and then we have the data and monitoring. I've been with Verisys for a little over a year and a half now, and the way that we pivoted with our data, because the industry is kind of starting to catch on and say, hey, I think data might be the key to unlocking some of these problems that we had. But you can see our data is used in more use cases. So not just in credentialing, not just in provider directory, not just in enrollment. Our data is now being used because the cleanliness of it and the importance of it is in prior authorization, pre-authorization. Anytime that someone goes to a hospital and a surgeon is about to have his schedule filled, or we're running those credentials right then and there in real time. Claims editing, payment integrity. Anytime that a prescription gets filled, that real-time data is clean. So that's where the data-first mentality is let's catch this ahead of time and be proactive versus being reactive and getting a fine, getting put on the exclusions list.
Absolutely. I think the other piece that the industry is ready for is we've gone to one solution fits all. It doesn't. It never does. Healthcare is too complex and dynamic for that. And it's not about bolt-on technology solutions. This is about thoughtful, integrated ways to look at data first, and then your technology works almost agnostically, but also in a seamless way. And that, to me, is the flexibility that the industry is looking for. Also, you can't take 6 to 18 months to do implementations. Healthcare is moving too fast. And so a thoughtful, intentional approach to that is about taking care of the data first so that you can really use the technology faster or efficiently.
That's fantastic. And so how are you solving this problem as partners in mind?
So from the starting point, I think, Nicole, I'll let you go first because you kind of start at the front end of the data.
Yeah, if you look at it, kind of what we've had a discussion along the whole time is if you look at it from a credentialing standpoint, if I'm Nicole Berryman and I'm going to go work at University of Utah Health and I'm going to be credentialed inside the hospital, I have to go through an actual credentialing event. So I'm there, I got my credentials. Okay, now what? Usually a re-credentialing cycle, whether you're following NCQA, your Act Joint Commission, is every 2 or 3 years. What happens in between those credentialing cycles? You have to be monitored ongoing for any type of changes in your license status, any type of exclusions that you may have. You look at our partnership, we're that whole front where the data is clean from credentialing to data to monitoring. And then from there, it's ready for Madaket.
Yeah.
Yep.
And from that perspective, this is saying, okay, taking that living, breathing data, making sure that it's always refreshed, a consistent approach to that data integrity. And then we're taking it all the way through the payer enrollment process, right? How you manage every aspect and constant data that's changing into that payer world and making sure that it's going seamlessly into payer rosters, seamlessly into claims payment, the integrity that's there, but also giving transparency throughout that process and saying, this is where everything is operating in this ecosystem, and this is the always on campaign of data management that we're seeing. It also is about saying, how do you want to change your data strategy? And it doesn't mean that you are beholden to somebody. We don't own that data, right? It's your data at the end of the day, we just didn't even about.
Well, it sounds like a very promising partnership.
Thanks.
Very exciting to hear about the progress that you guys are making in this data first approach. Talk to us, just give us some closing thoughts for our audience with us wanting to do more with their data and do better with their data.
Yeah. To me, it's about rethinking your data strategy. You know that you need to, you're regulatory required to. It doesn't have to be that scary and it doesn't have to be that painful. But having the right conversation about data quality and understanding what this partnership can bring to the table that's uniquely different. This is about solving those pain points in the industry. And you can do this in a very seamless way. And I think partnerships such as ours demonstrating that strongly in the market, but the demand is also there. And I think this is where the market is asking for these types of partnerships, and we're excited for that momentum.
Yeah, and I see it as a two-pronged approach. It's like we have the both of best worlds. We're really good at the credentialing data and monitoring side. You're really good at the provider directory data management side of things that before it goes into enrollment. Because we work with the top payers and all the time they're like, hey, we need better data. We're like, hey, we have a partner. Let's make an introduction. People are real.
Credentialing
Yeah,
data.
yeah.
Let's work with our best partner.
But the way that I also look at it is a lot of people don't realize across an organization, just take Intermountain Health for an example. They have multiple departments. They have credentialing, they have medical staff services, they have human resources, they have HR compliance, they have a pharmacy, and they usually have a health plan.
They own their own.
Yeah, because they're so big. And you want to think about it, the data is actually probably being used in 5 different departments. They have 5 different vendors, and it's more of an enterprise solution that we can offer through our partnership from an end-to-end solution. And it can cut costs, it can automate, they can have better data, they can make better decisions across that whole organization. So it's enterprise-wide.
Nothing more to say. They're that two best-in-class solutions coming together to solve the problems that the industry has. And I think that's the task in front of us, and we're ready for the challenge.
That's fantastic. So for everybody out there that wants to get in touch and learn more, where can they find you and your organizations?
Absolutely. I love LinkedIn. I think it allows us to create the network. You can see who we each know. So LinkedIn is obviously a great opportunity. And then MadaketHealth.com is where you can reach us and find our solutions. Whatever type of piece of the industry you're touching, you can see a curated experience of help you understand our solutions.
Yeah, and same. You can get a hold of me on LinkedIn. And if you want to go visit our website, Verisys.com.
Outstanding.
Probably more importantly, you know our faces now. We're standing up here at 5. Come and find us on the shore.
Come find us.
Find these gals. They're changing the industry for the better. Just so thankful that you guys tuned into this episode here at Vive in Los Angeles with Megan Schmidt, President and Chief Executive Officer at Madaket Health, as well as Nicole Berryman, Senior Vice President of Growth and Partnerships at Verisys. Everything's going to be available in the show notes, so make sure you check those out, ways to get in touch with them, ways to learn more about their companies and how they're partnering to solve the provider data problem. Thank you guys for being with us.
Thank you.
That's all.